Good afternoon, everyone. My name is Kim Bittner, and I'm with the ESRD National Coordinating Center. Thank you for joining us for the ESRD NCC Patient Education Quickener. The ESRD NCC Quickener events are held in partnership with the Centers for Medicare and Medicaid Services. We are hosting these 30-minute events weekly. They feature patient and professional subject matter experts from around the country sharing how they or their organization are coping with situations related to COVID-19. Before we get started, I wanted to let you know this call is being recorded and will be posted on the NCC COVID Quickener webpage, usually within 72 hours. Let's take a look at the agenda for today's call. Today we have two speakers. First, Dr. Shannon Novosad with the Centers for Disease Control and Prevention. Also joining us is Stephanie Booth, also with the CDC. Today they will discuss how facilities are keeping patients safe from COVID-19. As our speakers go through the presentation and you have questions, please submit them using the chat feature through WebEx or the Q&A on the lower right of your screen. When we get to the question and answer section of this presentation, we will share the questions we have received with our speakers. Our goal is to answer as many questions as time allows. So what's this call about? This Quickener will address changes you may see at the dialysis facility during the COVID-19 pandemic and explain how these changes help prevent infections and keep patients safe. Key topics include use of face masks and cloth face coverings, the importance of limiting non-essential staff and visitors at the facility, and tips for speaking up about care. Now let's introduce our speakers. First, Dr. Shannon Novosad is a medical officer on the dialysis safety team in the Division of Health Quality Promotion at the CDC. In 2015, Dr. Novosad came to the CDC as an Epidemic Intelligence Service Officer assigned to the Division of Healthcare Quality Promotion, where she investigated outbreaks in healthcare settings. Her areas of concentration include prevention of central line-associated bloodstream infections and increasing safety of patients on dialysis. Stephanie Booth is the Infection Prevention Educator for the Making Dialysis Safer for Patients Coalition. She has a degree in Healthcare Administration, a certification of Infection Control, and is contracted by Northrop Grumman in the Division of Healthcare Quality Promotion at the CDC. Stephanie's expertise relies heavily on her more than 15 years of experience in the dialysis setting as a certified tech, biomed tech, clinical coordinator, and educator. Thank you both, Dr. Novosad and Stephanie.
Thank you, Kim. Thank you, Kim, and thank you to the NCC for inviting us to participate in this Quickener series.
We are very pleased to have both of you here.
Thank you. You can go to the next slide. Well, today I'd like to start with emphasizing something that most of you probably already know. While we've learned a lot over the past several months about coronavirus, we are still learning new information that could change recommendations. So today I'm going to discuss a few of the changes or protective measures that you may be seeing in your dialysis facilities and some of the reasons behind these changes. However, you may see new practices at your dialysis facility that I don't cover today. With that in mind, I'll be covering changes that include facilities asking you to wear a face mask for your entire treatment from the time you enter the building until the time you leave, a change in your treatment time, day, or even your facility to make sure you receive the safest care possible, visitor restrictions to keep you and others safe, and I will wrap things up with some tips for speaking up about your care. There should be plenty of time at the end of the slides for Shannon and I to answer some questions as well. Next slide. So let's start with what we know so far about COVID-19 symptoms. Symptoms of COVID-19 typically appear 2 to 14 days after exposure and can range from mild to severe illness. Symptoms may include cough, fever, chills, muscle pains, shortness of breath, difficulty breathing, sore throat, or a new loss of taste or smell. However, this is not a list of all the possible symptoms of COVID-19. You should not hesitate to call your medical provider or your dialysis clinic for any symptoms, not just the ones listed here that concern you. Next slide. COVID-19 spreads mainly among people who are in close contact with one another, within about 6 feet apart, for a prolonged period of time. Spread happens when an infected person coughs, sneezes, or talks, and droplets from their mouth or nose are launched into the air and land in the mouths or noses of people nearby. The droplets can also be inhaled into the lungs of people nearby. Another way the virus is spread is through contact with contaminated surfaces or objects. It may be possible that a person can get COVID-19 by touching a surface or object that has the virus on it, and then touching their mouth, nose, or possibly eyes. However, this is not thought to be the main way the virus spreads. Please keep in mind that COVID-19 is a new disease, and we're still learning how it spreads. CDC is constantly monitoring the science and updating recommendations to prevent the spread of COVID-19 to keep everyone safe. Next slide, please. One of the ways CDC recommends to decrease spread is through source control. Source control, in addition to social distancing, is essential to prevent the spread of germs and protect others. CDC recommends wearing a cloth face covering in public or within 6 feet of another individual to prevent spreading the germs that cause COVID-19. This is called source control because the face mask prevents germs from your mouth and nose, the source, from spreading to other people when you talk, cough, or sneeze. CDC continues to study the spread and effects of novel coronavirus across the United States. We know from recent studies that a significant portion of individuals with COVID-19 lack symptoms, and that even those who eventually develop symptoms can spread the virus to others before showing them. Your facility will try to minimize spread by asking that everyone in the dialysis facility, this includes patients, visitors, and staff, practice source control. This means that you may be asked to wear a face covering for your entire treatment. They may also ask you and your caregivers to wear a cloth face covering every time you leave your home. Facilities will also try to maintain social distancing practices, maintaining a distance of 6 feet as much as possible, and when providing your dialysis care, staff will wear personal protective equipment, clean their hands, and disinfect surfaces and equipment frequently to decrease the risk of infection and cross-contamination. Next slide, please. To limit the spread of COVID-19, it's important for dialysis facilities to promptly identify and separate patients who are ill, so you may see some changes in your clinic surrounding triaging procedures. CDC recommendations ask that dialysis clinics have a plan in place to ensure patients with symptoms are not missed, which may include having a staff member call patients before their next treatment to ask about symptoms, advising patients to check their temperatures at home before leaving for dialysis, and assuring that all patients know how to notify the facility if they do develop a fever or any other symptoms, and screening patients prior to entering the treatment area. Ideally, patients with suspected or confirmed COVID-19 will be dialyzed in a separate room, if available, with the door closed. But if a separate room is not available, the patient with suspected or confirmed COVID-19 should be treated at a corner or end of row station away from the main flow of traffic, if available. If a hemodialysis facility is dialyzing more than one patient with suspected or confirmed COVID-19, they may cohort or group these patients and the healthcare providers caring for them in order into a specific location of the unit or maybe on the same shift. Some facilities may even designate a certain location, such as a COVID-only clinic, and ask patients to dialyze here. As a patient, it's critical that you take steps to protect both your fellow patients and the staff taking care of you. If you have any symptoms of COVID-19 or any other symptoms that concern you, you should immediately notify your dialysis clinic, ideally before you arrive. Having advance notice of symptoms will allow your facility time to prepare and implement measures to keep everyone safe. So make sure you know how to contact if you develop symptoms or have any concerns. Next slide, please. So what other things can you do to keep yourself safe? These actions are important at both your dialysis facility, but may also be important in other locations. So first, avoid touching your face, nose, and eyes, because these are your mucous membranes that contribute to the spread of COVID-19, as discussed in previous slides. Also, appropriately wear your face covering. Make sure that it covers your nose and mouth completely, and try to limit the number of times you have to touch or remove the face covering. When removing, be careful not to touch your eyes, nose, and mouth, and wash your hands immediately. Although it is facility specific, some facilities may choose to limit eating and drinking during treatment at this time to avoid the removal of masks. You should also clean your hands frequently after handling high-touch surfaces. In a dialysis clinic, these items could include the door handles or scale buttons, but these are just a couple of examples, and each dialysis facility may be different. So really think about the items in your clinic that you and others touch on a regular basis, and be sure to perform hand hygiene after handling them. It's also important to be aware of your facility's specific visitor restriction policies. Facilities may be eliminating, limiting, or screening visitors at this time to prevent inadvertently bringing COVID-19 into the facility from someone who is not showing any symptoms at all, but could still be spreading the virus and putting you and the other patients at risk. If there are visitors allowed, it's important that they adhere to all the practices that we have already discussed. They need to be screened for any potential symptoms, separated from others, maintaining that distance of 6 feet, and wear a face covering. But most importantly, remember, do not postpone your dialysis treatments. Next slide, please. Keeping yourself informed is an additional way to keep yourself safe and learn more about COVID-19. CDC has created 3 videos to assist staff with all of the additional measures clinics should be taking to implement CDC guidance at this time. The first addresses infection prevention basics, such as hand hygiene and cleaning. The second is focused on the personal protective equipment staff are asked to wear. And the third is on screening and placing patients. Although these were originally created for staff, I encourage you to watch them as well. It's important to be informed on the guidance measures staff are being told to perform to give you a better understanding of all of the changes you may be seeing in your clinic. It can also give you some common ground to have some great conversations about COVID-19 and infection prevention. Next slide, please. Remember, it's okay to speak up and have conversations about infection prevention. Don't be afraid to use your voice. You are the most important member of the dialysis team, and it's okay to ask staff questions about the measures they are taking to keep you and the other patients safe. Some example questions to get you started might include, what is the clinic doing to prepare for COVID-19? Or how will these changes affect my treatment? Or what can I do to protect myself and others? Or simply, do you mind cleaning your hands before you care for me? CDC has a couple of newer resources created to address speaking up in dialysis. The first is a video on the importance of speaking up, and the second is a tip sheet for staff to accompany the video. Patients on dialysis, caregivers, and dialysis staff are all encouraged to watch and share these videos and use the staff tip sheet to create a culture where everyone feels comfortable speaking up and having conversations about infections in dialysis. And this includes conversations about COVID-19. Next slide, please. And finally, there are many dialysis-specific resources available on the CDC COVID-19 website. Today, I just want to highlight a couple that might be of interest to you, and it addresses many of the topics we discussed today. The first is the Screening and Triage at Intake for Dialysis Patients webpage, which includes general steps for screening, considerations for staff, and cloth face coverings. There are also 2 fact sheets pictured here. They're titled, How Our Facility is Keeping Patients Safe from COVID-19, and Coronavirus Disease 2019, Keeping Patients on Dialysis Safe. Both are informational handouts created for facilities to share with patients and caregivers to explain how they are preparing for COVID-19 and what precautions patients and caregivers can take during their daily activities and their dialysis treatments to stay safe. And I believe that was our last slide. So thank you so much for your attention. And I think we now have time for a few questions and answers, but I'll turn it back over to you, Kim.
Stephanie. We appreciate all that information. I am going to ask Matt if he has received any questions. We asked in the beginning if while we were presenting, if you had any questions, if you could please submit them through either the chat or the question and answer. And Matt has been keeping an eye on all those questions that we were receiving. I'm going to ask for Matt's help as we go through those questions.
Certainly. We have received a handful of questions so far. So I'll jump right in, and I want to make sure that our two speakers are unmuted. It looks like they are. So the first question that we got was somebody who is getting mixed messages about wearing gloves. Should they be wearing protective gloves in public, or is the mask enough?
Hi, this is Shannon. We don't have a specific recommendation from CDC that gloves need to be worn out in public. It's not that that you should or shouldn't wear gloves, but we don't want people who are, wearing gloves to think that kind of replaces the need to do hand hygiene, and that really the hand hygiene is the most important practice to be paying attention to. I mean, a lot of times, when people are wearing gloves, they tend to perhaps wear the gloves all the time and forget kind of all about all of the other hand hygiene that they need to be doing and think that it's providing enough protection, when really we know it's the act of hand hygiene and the time required, the steps, the friction and everything related to it that really does the best job. So that's why there's not a specific recommendation for gloves.
Very good. Yeah, the basic hand hygiene supersedes everything it seems like there. So another question that came in, excuse me, this came in from somebody who apparently is having a little bit of allergy issues. If I don't have a fever, but I have a slight cough, and I'm assuming due to allergies, should I inform my dialysis unit? I don't want my allergies to set off any unnecessary concerns.
Yeah, I think it's important to notify your dialysis facility for having any symptoms that you think could be concerning for COVID. While we know some of the symptoms, sometimes can be vague, and a lot of things can cause a cough or sore throat or, many of the symptoms that were listed earlier. We also know that COVID is a spectrum of disease, so we don't want to kind of assume, offhand that it's not. And so that's why it's important that your dialysis clinic knows and any of your providers know, and they can kind of, evaluate on a case-by-case basis whether, additional testing is needed or not. But again, I think just the knowledge up front is probably the most important for the clinics and all of the providers to help them make that decision. And I think kind of as you mentioned with the question as well, I think we're all, extra focused on, how our symptoms may be perceived these days. So again, I think it's just kind of in approaching this and kind of as we're all in this together and, watching out for others too. I think that's a good thought as well.
Certainly, and it's funny that you say that because I've gotten dirty looks at the grocery store when I sneeze, and so people are hypervigilant, and we want to make sure that we're as transparent as possible, obviously. As a reminder, if you do have a question to submit, when you do submit that in the chat panel, please select all panelists so that all of us who are connected can see it, including our speakers today. Another question that came in, and I think this is referring to the earlier slide when you said you're still learning about this disease. I think back in April, there were some concerns that COVID could be transmitted on shoes even, or, articles of clothing. Obviously, there's been some additional knowledge since then. Is there anything that people should be concerned about with, I specifically was mentioned shoes, so.
I don't think there's anything specific in regards to those items. I think, shoes and things like that come up frequently, not just with COVID, but, when we're thinking about how other, infectious diseases could be transmitted. And in general, the research, has shown that, transmission with shoes and other stuff is pretty low, even though in your mind, I know you're thinking as I am, you're walking on the floor and it's dirty and everything. So
right.
It's an obvious thing to think about. But in terms of, what we've seen with transmission for this and other diseases, that we don't think it's kind of a main mode of transmission. And so, again, I think just thinking through, as you would kind of anything, you come home, like you wear your shoes, I'm just an example, you wear your shoes in your dialysis and you come home, you take them off. I think it's just doing still all of the general things that we've emphasized. You're coming home from dialysis, it's a good time, to do your hand hygiene and just do all of that stuff. But there's not a specific thing, I think, to be worried about in terms of shoes. So not like, not a need to wear like shoe covers or anything along those lines.
I think that was actually what the question was alluding to, so thank you for that. This is an interesting question. I don't know if I'll just go ahead and ask it because it was asked. Do I need to worry about my dog coming into contact with people when we go out on a walk? Should I keep her socially distant from people too?
That's a good question, and I don't know that we've, I'll be honest, I think we're still learning about, transmission or ability of COVID to infect pets. But I think, based on what I know, and I am not completely up to date on all of the data and information surrounding that, I think that, I don't think that you have to necessarily worry about in as much as your pet, but I guess I would throw out there just in terms of thinking through like social distancing in general, just, all of the stuff if people are coming up to see your pet closely and that kind of stuff, and then is that keeping you socially distanced as well? So again, I don't know that it fully answers the question because I don't think we 100% know everything with animals, but we do know animals can become infected. Full disclosure, I have my dogs, and I probably haven't been doing a great job with that as well. But I guess the bottom line is I don't think you necessarily need to keep the animals, based on what we know now, I think socially isolated from people as long as they're not, actively showing signs of COVID or anything for them. But I do, again, just thinking through all of the practices that we do every day, I think, it could end up being that maybe you're not able to stay socially isolated with some of those.
Maybe that becomes the crux of the question, is the social isolation there. So, question came in about cleaning masks. This person has a N95 mask. They want to know if they can clean the N95 mask, or how often can they re-wear a mask without it being cleaned. And as far as cloth face masks go, how often should they be cleaned?
Sorry.
Oh, go ahead, Stephanie.
I was just going to say, I can speak to the cloth face coverings, but I'll turn it over to you for the N95s. The cloth face coverings on the CDC website, there's actually a site that tells people how to wear them, how to remove them, and it actually addresses stuff as to how often to clean, and they recommend that you clean daily. So that's what I know about cloth face coverings.
Yeah, and I think that in general, the N95s are probably should be used most often by healthcare personnel. I mean, I know patients who do have them from, acquiring them from various means. And for healthcare personnel, although we know that people have been having to reuse them just because of a lot of supply issues and extended use, in general, that we would not recommend reusing them unless it's really like a supply issue where they're having to reuse them. And then it's, I think it depends on the facility and the type of mask and everything. So there's not an easy recommendation to make for N95s, I think, as there is in terms of the cloth face mask. Because, for example, you can't wash them and that kind of stuff. So I think it's more, avoid reusing them unless you have to in some extended, capacity because of supply shortages. And then I think then it's more just kind of how you handle them as to not, contaminate yourself or others when you take them off. But again, I'd emphasize that, those should probably be really used most by healthcare personnel because of kind of the intrinsic nature of how they work and everything.
A follow-up question came in as we were speaking about that. Is it true that we are in what we'll quote the new normal meaning we're going to be wearing face masks whenever we are out and about, or do you foresee this reverting back somewhat anytime soon?
So just speaking from personal experience, I hear that term a lot, the new normal. And I think that we need to just be cognizant that, what we're going through now is new, and we don't know everything we need to know about this disease. And so, new normal is kind of a vague term. I think that maybe we just need to take it a day at a time and go forward from there.
Very good. Yeah, we're all learning, I suppose. And this is a very good question just came in related to how long, I guess, you're required to be exposed for transmission. My treatment lasts 4 to 5 hours. If I take my mask off for a few minutes or a couple times during my treatment, could I get COVID is the question. But I guess ultimately it's how high does the risk become is I think what another way to ask that would be.
Yeah, I don't know if I can fully answer that question with a percentage or a number with risk, but I think some of the things that we just need to keep in mind is that you're wearing a mask to protect those around you. It does offer some protection from you getting COVID as well, but I think the main key point is to know that you're wearing it to protect others. So when you remove that mask, probably the bigger concern is, am I spreading it to others if you were to be asymptomatic? Shannon, do you have any thoughts on that?
No, I think it's true. I mean, I think it's something that is really difficult to quantify, and we may have more information on that, as more studies are done, but there's not, I think, a concrete answer that we can give. I mean, I think in terms of a time period to have it off, obviously a shorter time period would probably be less of a risk, but I think there's so many variables to take into account with that in terms of, is there anyone around you that's sick and that kind of stuff, that it makes it even harder to give a full answer. So I think in general, as Stephanie said, I think, again, keeping it on, it really does provide some protection for you, but really is, helping protect others in the dialysis facility. And so minimizing the amount of time without the mask on is really the best practice that we can all do, realizing that you might have to take it off briefly to take a medication or something. So, I mean, there obviously, that's reasonable. But again, I think getting the mask back on as quickly as possible. Again, I think all in that spirit of, we're kind of all in this together. And again, wearing that mask is really to protect others.
Of course. I think we have time for 2 more questions. One came in and it was asked specifically about dialysis units, but I'm going to expand it to talk about just healthcare in general. Do you think that these types of restrictions will be kept in place after this pandemic is over, whenever that might be? Do you think these will be permanent adoptions of policy?
I don't know the answer to that, but I do think that there are some things, that we're learning through this pandemic, some practices that are being enacted that I think, are good practices that we should think about how we would keep them up long term. Thinking specifically about kind of, some of the screening that we're doing, some of the symptom monitoring is something that, might be very important as years go by just for influenza and other respiratory illnesses. So I don't think, all of the things that we're doing during the pandemic we will need to keep doing, long term after this is over. But I do think it's definitely highlighted some areas where we can improve infection control in general and, should consider how we can incorporate that kind of into the usual flow. I don't know, Stephanie, if you had other thoughts.
No, I agree. I think working in dialysis, that was one of the things that I always saw as kind of one of the things that we don't do so well, which was, the triaging and the making sure you know patient symptoms before they come into the clinic and sit in their dialysis chair. And so I think that would be one that I also would think might be able to carry over. But again, we don't know at this point.
Understood. And one last question, and this is actually a question I've never thought of. Are there any recommendations for cleaning things like magazines, these commonly used items that are in waiting rooms, or patients are sitting in a chair for 4 hours and they're reading something? Is there any concern with those? Should there be a good policy for cleaning those or sanitizing those? Or are you aware of any way to do that effectively?
Yeah, so there are definitely some things that, we can't clean or disinfect as we need to. And in general, we try to obviously avoid bringing those into the dialysis station as much as possible, but, do know that those could be there. So those are really, I think, things that we would just say need to be kind of removed and disposed of afterwards. Just, we don't really, I think, have the technology yet to clean and disinfect everything that could potentially be brought in. I don't know, Stephanie, did you?
No, I think that the recommendations actually do state that those type of things like the magazines or books shouldn't be placed in the waiting rooms because you're right, you can't disinfect those properly. So that's just something to think about. It's a good question.
That's one of those things you just never consider till you're holding one in your hand, I suppose. So, Shannon and Stephanie, thank you both so much for joining us this evening. That brings us to the end of our questions, but I did want to take a moment and say thank you for your time tonight, and we're looking forward to speaking with you again on tomorrow evening's event.
Thank you.
Great, thanks so much.
Thank you. We'll go ahead and begin our wrap-up here. Before we do that, we just want to remind you about the kidneyhub.org. This secure, mobile-friendly web tool for patients has links to important resources, such as the COVID things we're talking about tonight. There are also some new features, such as the patient grant library, some new videos about understanding high KDPI risk, increased risk kidneys, and more. And those videos are all available from that mobile app. So take a visit today to the kidneyhub.org. There are instructions for bookmarking it to your home screen if you'd like to do so. And we'd certainly love to hear your thoughts about this new tool. Our next events, tomorrow evening is our next provider-focused event. It is at 5 p.m. Eastern. And then our next patient-focused event, June 30th, 2020 at 5 p.m. You can visit www.kidneycovidinfocenter.com for information on all of these events and to register for any upcoming events. Again, www.kidneycovidinfocenter.com. So on behalf of the NCC, I do want to say thank you for joining us this evening. We have additional resources for you to visit. You've seen this slide perhaps before, but this slide will be available on our website, as Kim noted earlier. About 48 hours, we should have the recording and the slides up. So we encourage you, download that, visit these resources, and obviously continue to learn more. We want to thank you for your time this evening and hope to see you on a future event.